Women in cancer leadership in Nigeria face many barriers, including gender bias, discrimination, and lack of resources. According to the World Health Organization data, women make up 70% of the health workforce, but only 25% hold senior roles. At this leadership program for women in oncology, experts have identified ways to bridge the gap in these areas. Sophie Busman, who is the Regional Director, African Europe City Cancer Challenge, gives more insight.
This is a global challenge that we are addressing, and that challenge was also a pledge that led us to the Clinton Global Initiative platform in New York, where we launched it for a 10 million funds for 7 years, where we will be actually also scaling and listening, implementing solutions that will address this issue of gender gap. So as SICAN, we're not coming to say that we have the solution. We're coming to say we have identified this in the work that we do in the cities through our engagement process.
Head National Cancer Control and Nuclear Medicine Program, Uchechukwu Nwoku, says since women carry much of the burden of cancer in Nigeria, it is important they occupy leadership positions in oncology care. Representative of the National Institute for Cancer Research and Treatment highlights the role it plays to ensure equitable representation of women in the field.
Even though the government of Nigeria has launched that vaccination program and has made tremendous impact, some of the myths around it were also some of the women not comfortable with some of the myths around the vaccine. So we believe that if women take leadership role in advancing this cause, the uptake of the vaccine might be better. If women are in the leadership role in advancing cancer prevention, the willingness of their fellow women to go for screening and early treatment will also be better. So we believe that government supporting this will also enhance uptake of cancer care services, including vaccination, screening, and early detection, and all of that.
If you look at the composition of the leadership of NICRAT in terms of management and also in terms of employment, all this, in order to address leadership of women in oncology, out of 7 top management positions in NICRAT, 3 are women. That is over the 35% affirmative action that we have. And also, if you look at the recent recruitment in NICRAT, the recruitment in terms of gender, it's 50-50. In short, we have 2 extra women. So women are more in the recruitment by 2 than the men.
This leadership launch by City Cancer Challenge is one step towards addressing the disparity of women in leadership in oncology.
When we make policies, we don't make policies that are only one-sided and solve maybe the supply side of healthcare, saying, oh, we have the instruments, we've built the hospital. You also need to think about who are the physicians that will manage, and the nurses and the lab scientists and the pharmacists that will care for.
Policies have to be put in place to bridge this gap. Uli J. Wapera, Arise News.